was a great feedback. People were like, man, I didn't know that was there. And so we said, you know what, there's a lot going on. We know we have these centers at different hospitals and all this other stuff, but let's make it more available. So we've been able to do the 21 sites. Again, over 40,000 patients as of right now have received treatment, and we're typically doing over 4,000 a day now, which is a really good clip. This site here in that we have in Merritt Island is in Brevard. Has done close to 3,500 people, probably more than that as of this time, because they're doing them as we speak. And I think this community in particular, the healthcare folks and everything, have really worked hard to alert people that this is something that they could avail themselves with. Of course, that site's open 7 days a week from 9 to 5. In this region, Central Florida, we also have one in Ormond Beach in Volusia County, and then of course at Camping World Stadium in Orange County. And if you'd like to find out more information about the treatment locations, you can visit floridahealthcovid19.gov. To register for treatment at a state site, you can visit patientportalfl.com. And prior to us setting up these sites, in order to get a monoclonal antibody treatment, you had needed a referral from a physician. What we have done with the Surgeon General putting in a standing order, you don't necessarily need to have a referral. So you certainly can speak with your physician, and we encourage people to do that. But it takes away a step. And so if you're somebody that is infected and you meet the criteria, which are pretty broad, you're able to come in and do it. And so this has been treatment that's been proven to be beneficial to keep people out of the hospital, particularly people that are at higher risk of hospitalization. So folks who are elderly, folks who are overweight, folks who have problems with diabetes, kidney problems, cardiovascular, lung conditions. Those types of patients can really benefit from this. And so we would encourage folks to be able to do. Now, you got to do it early. This is something where when this hits, typically, obviously, most people recover without a problem, which is good. Most people have relatively asymptomatic or mild infections. What happens is people produce antibodies, they fight back the virus, and then they recover. Well, in some people, particularly the higher risk groups, those antibodies aren't necessarily produced to the extent they need to, so that's what this is providing. We're using Regeneron, but you also have others. It's basically an antibody cocktail. Puts it in and then allows more ammunition in terms of antibodies to fight against the virus's progression. Once you get to the point where you're incredibly ill in the ICU, then taking it at that point is likely not to turn it around. And so if you do it early when symptoms are onset, it has a really good track record of resolving the symptoms. So we have some folks here who are talking about, and oh, by the way, we're using the Regeneron. It's free for patients. Folks, don't let anyone tell you they're going to charge you $2,500 or whatever. It's just not true. And it's also the only one that's approved for use as a prophylaxis. And we'll actually hear a story about that. And it's also the only monoclonal that's approved for subcutaneous. And so injections, you can do an IV for an hour, or you can do 4 shots and be done with it. And so that gives you a lot of versatility, allows us to do more. So we have Rob Dale here. He was diagnosed with COVID, and he was he was able to utilize the Kiwanis Island Park site here in Brevard County to get his treatment. So, Rob?
Hi, I'd like to first take this opportunity to sincerely thank the governor and his staff for making the program available, the Regeneron program. A couple weeks ago, I was diagnosed with COVID. The next day after diagnosis, we went down. They had just established the program, and for all I know, he and his staff may literally have saved my life and my fiance's life with the availability of this. I've lost family members. I've lost friends during the whole COVID issue. And the way that this worked, I was having symptoms, had fever, had heaviness in my chest, probably a little bit of fluid. We went and got the treatment. I was a little concerned. They talked about 4 shots, 2 in the belly. The belly has always kind of concerned me, kind of a sensitive area, but actually felt nothing, essentially, in the belly area. The arms were like regular shots. We went out, they monitored us for an hour, had no issues. That night was probably the worst of it. I won't sugarcoat it. I did have a little bit of night sweats and chills. The next morning, though, essentially the way I look at it is the serum. I actually joke about it, I call it the Captain America Super Serum, and it actually, I had no heaviness in my chest. All my symptoms were gone. My fever was gone. Still had to maintain the quarantine, and that went on for a while. But full recovery, and same thing for my fiance. So I am very thankful for the governor making this program available. Again, I would echo that. The first thing out of my mouth, I'm a financial planner. I want to know how much does it cost, and at no cost, it was a no-brainer for me. So,
Is she gonna talk about, or you wanna talk about the prophylaxis?
Michelle, would you like that? Well, Michelle, my fiance, was experiencing not diagnosed with COVID, but she took it as a preventative, which is one of the other reasons to get the serum. She has asthma, and we were very concerned about her getting it from me. I mean, we tried to separate ourselves, but you live in the same house, and it doesn't work out that way. But all I know is on January 2nd, I get to marry her because we're in good shape now. So I'm very thankful.
All right, great job. Okay, Bill and Joan, you come up and talk about, yeah, whoever wants to be the spokesman, you guys think.
Want me to start?
I'll start. Okay, I'm Joan Grodzki. I'm one of probably the first ones who got the infusion, December 22nd. December 20th, started experiencing some coughing that became constant coughing. Went to a clinic, got diagnosed with COVID, told to go out the back door, that there was nothing that they could do to help me. Now, I'd like you to know that I did the preventative as far as wearing my mask at all times. I was taking the supplements that were supposed to help me. I did everything that I thought I should to protect me from getting COVID, and we still got it. I left there with some inhalers because I do have asthma and I do have heart issues, so I was very frightened with the diagnosis, thinking this is going to be bad news for me. Called my personal physician. He also was unable to help me. I was told by both, go to the hospital if you get worse. I'm a retired RN. That's the wrong answer for me. The answer is, let's do something that we can do now before you get to that point. Because as we all know, our hospital staffs are overworked. They're exhausted. We need to do something to help them also. So I was fortunate because my neighbor knew Dr. Todd Husty, who is Seminole County Medical Director. Dr. Husty called me and he said, let me help you. He said, there's something new out there called monoclonal antibody infusion. And he said, Advent Hospital Outpatient Infusion Center is offering it. He was able to get me in within 24 hours. Now, mind you, at that time, then I had a fever of 102.9. I had horrible racking chills and body pain. I was short of breath. I got in for the infusion. Within 24 hours, I did miraculous, turnaround. The coughing was barely there. The fever was gone. The pain was gone. I was so relieved because I felt it truly, truly saved my life. And unfortunately, my husband got it 4 days after me. And we're just so thankful that the infusion was available. And it was a little bit different then because the infusion took place over an hour, and they watched us for an hour, and for a week they kept track of us on an app on our phone. So we had to give our vitals and our symptoms and what was going on, and if it didn't look right, they'd call us back right away. So things have definitely progressed in a good way, especially with the sub-Q being available now. So I'd like to turn it over to Bill, and anyway, thank you, Governor. We truly appreciate what you've done for us.
Yes. I'm Bill Grodzki, and my story mirrors Joan's somewhat, but I am not retired. I work for a national home respiratory company, and my job is the liaison for the Florida Ventilator Center, which is located here in Melbourne. We provide ventilators for people at home as well as other respiratory equipment. So I'm in and out of the hospital, the ICUs, almost daily, seeing patients and evaluating them, as well as their caregivers, to see if they're a candidate to go home on a ventilator. I was convinced that I was gonna contract COVID. If I did, it was gonna be from the hospital. However, it was on our little birthday vacation trip out of state where we contracted COVID. I was several days behind her. Fortunately, when I got symptomatic, and I went to get tested and was tested positive for COVID, I had already seen what the monoclonal antibody infusion did for her. So I was not gonna let them send me out the back door with directions to go to the hospital if I got worse. I insisted on a referral for the antibody infusion. They had to do some research. They made me wait in a little isolated room, and they had to look it up, and I provided them with all the information I could. Fortunately, the doctor sent me out of there with a referral to Advent Health's infusion center. The next day, the doctor told me, don't call them, they will call you. I kind of don't believe that because of my, how I operate in the hospitals and the lack of return calls that I get, but they called me right away that evening and said, can you come in first thing in the morning? So the first thing in the morning, got the infusion, and just like Joan, with all the symptoms I had, high fever, extreme fatigue, achiness, the next day, within 24 hours, I was well on the road to recovery, and within a couple days, I felt completely fine. Still had the loss of taste and smell, which was very frustrating, but all in all, it was, I felt also that it saved my life. I have an autoimmune issue for which I take immunosuppressive drugs, so I was at high risk for getting worse and not having a good outcome. So I felt truly blessed by getting the infusion, and I am so happy that not only is the general public being informed about this, but hopefully some of the doctors who I know in a lot of cases are still not aware or are not referring patients to these centers. Thank you.